Welcome back to the Morning Blend. Did you know that the highest concentration of stem cells in the adult body is in our fat stores? That is why when it comes to using stem cell therapy, it's very beneficial to use a patient's fat. This new treatment is now helping doctors treat chronic pain and help people avoid even major surgery.
That's right. Dr. Deborah Mangione is the owner of the Wisconsin Vein Center and Medi Spa, and she's here to introduce a new partner clinic called Transformed Therapeutics. And Dr. Scott Stanwyck and Kevin Tadish are here to chat about more. Good to have you all here.
Great to see you all.
Glad to see you.
Good to be here.
It's tough because so few of us have fat on our body.
Yeah. Like, where would we go to get that?
I just don't know. But this is incredible. You can literally use your own fat cells and get stem cells from it.
That's right.
I didn't realize that there was stem cells in your fat.
Me either.
Well, they're not in the fat.
Well, they're in the perivascular tissue, which is the highest density of capillaries in your bodies, in your adipose tissue. And if you eat a lot of brats and cheese and drink beer, you get a fair amount.
You got plenty.
You get a fair amount of adipose, and we treat this stuff and basically inject it in joints, sometimes in your blood, and treat many different things. And we're seeing great results for things like knee arthritis, shoulder arthritis, hip arthritis.
And I want to get to a list because I think people are going to be not only fascinated but very encouraged. Well, here it is. It's the conditions that are responsive to this type of stem cell treatment, which is incredible. But Dr. Mangione, just talk about why this partnership, because this is new to your clinic and what you're doing at the Wisconsin Vein Center Medi Spa.
So basically, you know, we're about well-being. It's not just about looking great, it's about feeling great. And I think that a holistic approach is extremely important when we're talking to people about how they want to look, how they want to feel. A lot of it's from the inside, okay? And you don't necessarily look your best if you're not feeling well. And so we want to encourage this whole state of well-being. And so I've partnered with two very experienced board-certified orthopedic surgeons with over 25 years of experience each, some of whom I've known a long time. So we offer these kind of
Why are you giggling, doctor?
It's not always been easy for me.
Because they're married.
They're married. Yay.
So actually my husband came out of retirement as an orthopedic surgeon after being retired for 6 years.
So
That's my fault.
You brought him out, huh?
I did.
This has got to be kind of unusual. Your orthopedic surgeons, it almost sounds like this is the kind of treatment that could put the kind of work that you've spent your lifetime doing out of work.
well, that's exactly
Because
right.
you guys do joint replacements and all those kinds of
But
things.
you know, I forget which one of you had the book that says 65 things to do in your retirement. Number one is retire. And I figured that when Kevin and I started talking about this, it's so exciting and so rewarding. I mean, we have people that tell us they love us, tell us we're awesome, and it's not my wife, I would say that.
And it's still okay.
And, you know, we have people that truly need a total knee or hip. We treat them and they come back
you
and
can
say we feel great.
Avoid, in some cases, a complete joint replacement if you do this stem cell therapy?
Yes, so that's the goal. And so there's going to be no shortage of work. We were just reviewing the statistics on the way in. 11,000 baby boomers are retiring every day, and over half of them need knee replacements, let alone shoulder, hips, and all this. The workload is going to be tremendous, and our country is facing a huge, what they call arthritis epidemic. So there is no shortage of work for us or anyone, any orthopedic surgeon. And if we can make people better without a major operation, we feel we're going to help society in a major way. And so Scott and I are both really excited that this new technology is coming around because we've done all these surgeries. And I think it's a really exciting time.
Yeah.
Is there risk involved? One of the things I saw on the list is that you can use it for autoimmune. I know you mentioned injecting even into the blood. I think autoimmune disorders is something so many struggle with, and they feel like there are no solutions.
That's exactly right. And we've seen things like interstitial cystitis respond beautifully to this, rheumatoid arthritis. We're even starting to look at type 2 diabetes because it's an inflammatory condition of fat. And
like Crohn's disease.
Crohn's disease, ulcerative colitis.
Even that.
Yes.
It's unbelievable.
And some of the early data suggests that 90% of type 2 diabetics may improve. I mean, this is huge.
What about things like fibromyalgia?
Well, you know, that's an unknown etiology. We don't know what causes it. So will it help? It's really hard to answer that.
Okay.
So is there risk? Is there a risk using your stem cells within your body to put at different places?
None that we know of. This has been done now for many, many years by people other than us, and we've learned from the people that started it. And there's been no reported significant adverse effect. You know, occasionally with Kevin and I, our adverse effect has been a little bit of swelling in a knee after an injection for a couple of days.
Which people are probably like, fine.
Yeah,
Well, you know,
okay, I'll
that's
take
part
it.
of the disease process is swelling.
Yes.
And so we may, in probably 5 or 10% of patients, accelerate that swelling for a week maybe. But then it goes away and then people feel fine.
Wow.
And they've been doing this now for over a year in our clinic.
Over a year, and I've been doing it for
longer.
several years. I would like to interject too. There's a risk with every procedure, and but the beauty of this is compared to the risk of a joint replacement,
Yeah.
which is huge, with major bacteria now that are untreatable and blood clots and rejection, wear and tear. I think this is a great alternative.
So here's what I'm thinking is there are going to be so many people watching today and they're going to say, I need a hip replaced, I need a knee replaced, a shoulder, as you mentioned, I have an autoimmune disease. And they're thinking, how can I find out about this? And how do I know if I'm a good candidate? Are there some people who are only going to be a candidate for the more traditional joint replacement? How would you know if this might be an option for you? Because to think about an injection versus major surgery and a complete replacement, or to think you could end chronic pain is going to be, I think, mind-blowing to people.
Well, we are giving a seminar coming up in a week or two, and people can come and learn all about the nitty-gritty of stem cells. Can also find out who we look at as candidates. I also want to add that, not everybody we treat with stem cells. There are a lot of sports injuries that we can just draw a little bit of blood, take the platelets and make platelet-rich plasma and inject it into ligaments and tendons, and like for plantar fasciitis, tennis elbow, things like that. It works great. Arthritis of the little joints of the hand, it's amazing. It's not as long-term a result for like joint arthritis as the stem cells are, but it heals plantar fasciitis and
That's
tennis
incredible.
elbow and things.
Well, we
Yeah.
wish we could treat everyone. Unfortunately, not everyone is going to get a result, but the data is showing almost 80% of people are responding well.
That's incredible.
You guys have this seminar, so we want to make sure that we give the information for it so people can come out and learn about stem cell regenerative therapy. This is a seminar. It's Thursday the 25th. It's from 5:30 to 7:30, or 5:30 to 7 in Pewaukee, right on Georgetown Drive at the Wisconsin Vein Center and Medi Spa. It's learning about transformedtherapeutics.com, which is their new partner. Physicians. So learn about that. Here's the information for Wisconsin Vein Center and Medi Spa. You can call them at 262-746-9088 to learn more about the seminar. Do you have to reserve a spot?
Yes, you have to reserve a spot.
So reserve a spot, do that there, and then get some of that PRP and then put it on your face. Part of the facial afterwards.
that too.
Then you're gonna have great skin at the same time and heal everything
Lots
else.
of things.
And not as beautiful as these women.
All right.
Exactly.
Yeah.
Thanks,
Really
you
quick,
guys.
is it cost effective compared to surgery?
Way cost effective.
Way
right.
fascinating. Thanks you guys so much.
Thanks for being
Appreciate
here.
it.
Thank you.